Welcome to our channel. Today we're diving into the topic of edema. You know that feeling when you're wearing your socks all day and you take them off and see that indent they leave? That, my friends, is a very mild form of edema, a condition that causes swelling due to excess fluid trapped in the body's tissues. Now, edema itself isn't a disease, but it's often a symptom of an underlying health issue. Think of it like your body's check engine light flashing. It's telling you something's up, and it's time to figure out what. That's why we're going to break down everything you need to know about edema, from the different types and causes to the telltale symptoms, how it's diagnosed, and most importantly, the treatment options available. So, buckle up and let's get right to it. Let's start by understanding the different types of edema, because it can actually show up in different parts of your body. First up, we have peripheral edema, which is probably the type you're most familiar with. This is the kind of swelling that happens in your extremities, like your legs, ankles, and feet. Ever notice your shoes feeling a bit snug at the end of a long day? That could be peripheral edema. Next, we have pulmonary edema, and this one's a bit more serious. Pulmonary edema involves fluid building up in the lungs, which can make breathing really difficult. It's often associated with heart problems, so definitely not something to ignore. Then there's cerebral edema, which, as the name suggests, is when fluid accumulates in the brain. This can be incredibly dangerous as it increases pressure within the skull and can affect brain function. And finally, we have generalized edema, which is basically widespread swelling throughout the body. This can be a sign of a more systemic issue, like heart failure or kidney disease. Now that we know where edema can pop up, let's talk about what causes it in the first place. As I mentioned earlier, edema is usually a symptom of an underlying condition, and there are a bunch of potential culprits. Let's start with the big ones: cardiovascular disease, kidney disease, and liver disease. These organs play a crucial role in regulating fluid balance in the body, so when they're not functioning properly, fluid can build up. But it's not always about organ dysfunction. Sometimes edema can be caused by something as simple as an injury. Think about when you sprain your ankle, and it swells up like a balloon. That's your body's natural inflammatory response kicking in, causing fluid to rush to the injured area. Speaking of inflammation, infections can also lead to edema. When your body's fighting off an infection, it triggers an inflammatory response, which, you guessed it, can cause swelling. And let's not forget about allergies. Allergic reactions can cause localized edema, like when you get stung by a bee and your hand swells up. That's your immune system overreacting to the allergen. Certain medications, like some blood pressure medications or steroids, can also cause fluid retention and edema as a side effect. Hormonal changes, especially during pregnancy, are another common culprit. And finally, even something as simple as standing or sitting for prolonged periods can contribute to edema, especially in the legs and feet. Now let's talk about how to recognize edema. How do you know if that little bit of swelling is something to be concerned about? The most obvious symptom, of course, is swelling. This can be pretty noticeable, like when your feet are so swollen you can barely get your shoes on, or it can be more subtle, like a feeling of tightness or puffiness. Along with swelling, you might experience pain or tenderness in the affected area. This is especially common with peripheral edema, where the extra fluid puts pressure on the surrounding tissues. Unexplained weight gain can also be a sign of edema, especially if it comes on suddenly. This is because that excess fluid in your body actually weighs something. If you have pulmonary edema, shortness of breath is a major red flag. This happens because the fluid in your lungs makes it harder for your body to get the oxygen it needs. And in severe cases of edema, you might notice your skin becoming stretched and shiny, or even developing dimples that linger after you press on them. Now, it's important to remember that these symptoms can vary depending on the type and severity of edema, as well as the underlying cause. So if you're experiencing any of these symptoms, it's always best to err on the side of caution and see your doctor. So, let's say you're experiencing some of these symptoms and you're concerned about edema. What happens when you go to the doctor? How do they diagnose it? Well, the first thing your doctor will do is ask you about your medical history. They'll want to know about any pre-existing conditions you have, any medications you're taking, and any recent changes in your health. Next up is the physical exam. Your doctor will examine the areas where you're experiencing swelling, checking for things like tenderness, pitting, those lingering dimples I mentioned earlier, and changes in skin color or temperature. Depending on your symptoms and medical history, your doctor might recommend some additional tests to help pinpoint the cause of your edema and rule out any serious underlying conditions. One common test is a blood test. This can help identify things like kidney or liver problems, as well as check your protein levels, which can be affected by edema. Imaging tests like X-rays, ultrasounds, kinetic scans, or MRI scans can also be helpful in visualizing the affected area and looking for any abnormalities. For example, an echocardiogram, which is an ultrasound of the heart, can check for problems with heart function that might be contributing to edema. In some cases, your doctor might also perform a urinalysis. This can help detect things like protein in your urine, which can be a sign of kidney disease. Remember, getting the right diagnosis is key to getting the right treatment. So be sure to be open and honest with your doctor about your symptoms and concerns. Alright, now for the part you've all been waiting for, treatment. The good news is edema is often treatable, and the best approach will depend on the underlying cause and the severity of your symptoms. One of the most effective ways to reduce edema is by tackling the root cause. So, if your edema is caused by heart failure, for example, your doctor will focus on managing that condition, which in turn should help alleviate the swelling. But while you're working on addressing the underlying cause, there are also things you can do to manage the symptoms and find some relief. One common treatment option is diuretics, also known as water pills. These medications help your body get rid of excess fluid by increasing urine output. Compression therapy is another effective strategy, especially for peripheral edema. This involves wearing compression stockings or bandages, which help squeeze the excess fluid out of the tissues and improve blood flow. Elevating the affected limb can also make a big difference. So if your legs and feet are swollen, try propping them up on a pillow while you're sitting or lying down. And last but not least, let's talk about lifestyle changes. Reducing your salt intake can go a long way in preventing fluid retention. Regular exercise can also help improve circulation and reduce swelling. Remember, managing edema is often a team effort. By working closely with your doctor, following their recommendations, and adopting healthy habits, you can effectively manage your symptoms and improve your overall health. That was a lot of information about edema, but I hope you found it helpful. Remember, edema is a common condition that can have various causes, but with the right knowledge and proactive approach, you can manage it effectively. If you're experiencing any unusual swelling or other symptoms we discussed, don't hesitate to reach out to your healthcare provider. They can help determine the underlying cause and recommend the best course of treatment for you. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay healthy and take care.